Hi, my name is Carissa Hilton, and I'm a dietetic intern working with Not Your Average Nutritionist. The intent of this presentation is to offer some encouragement to parents and guardians who are seeking the best way to support their child who has or may have an eating disorder. Before we begin, I would like to acknowledge that I am not a healthcare expert. I also do not know your specific family situation, but I am only offering generalized advice that may help your situation. This presentation also cannot be used to diagnose someone you know who may have an eating disorder. This presentation is only meant to be used as a guide for supporting someone you know who is struggling with an eating disorder. Thank you so much for joining me today. So eating disorders are often very emotional with the tendency to thrive in secrecy. They often brew up feelings of shame and guilt for those struggling with these illnesses and can sometimes go undetected for many years. Whether an eating disorder has already been identified in your child or not, two words I want you to focus on today are gentle and collaborative. Friends and family are often key to encouraging loved ones with eating disorders to seek help. Whether they are unaware that there is a problem, they are afraid or ashamed to ask for help, or they are trapped in these concerning behaviors, many sufferers find it difficult to seek help. Family and friends can play an important role in identifying worrying symptoms to the sufferer and encouraging them to seek help. If you are concerned about the eating habits, weight, or body image of someone you care about, we understand that this may be very difficult and scary for you to bring up to them. It's not always easy to discuss eating concerns, especially with someone you are close to. However, you are doing a great thing by looking for more information. Many individuals now in recovery from an eating disorder say the support of family and friends was crucial to helping them get well. So remember, approach your loved ones in a gentle manner and be collaborative in their support. Here, I want to quote the words of the famous Maya Angelou. I've learned that people will forget what you said, people will forget what you did, but people will never forget how you made them feel. In supporting your child through this emotional journey, you may feel like you will say the wrong thing or do the wrong thing. If only it was so easy to say the right thing. But if you remember to be gentle and collaborative, they will always remember it the way you made them feel validated and supported. These words will ideally help remind you to create a space for your child that offers unconditional love before, during, and after eating disorder treatment. So today, we will go through a brief overview of eating disorders and discuss the concerns, causes, and symptoms of the majority of eating disorders. We'll bust a few myths about eating disorders that you may have heard. We'll discuss the best way to talk to your child with things you should and shouldn't say, and then some additional steps to move forward with. So to begin, eating disorders are serious medical conditions that millions of people of all genders, ages, races, religions, ethnicities, sexual orientations, body shapes, and weights combat daily. According to national surveys by the National Eating Disorder Association, or NEDA, an estimate of 10 million men and 20 million women in America will have an eating disorder at some point in their lives. However, many of them do not receive proper help or support. An eating disorder is defined as an unhealthy relationship with food and weight that severely impacts day-to-day life. The truth is that over 1/2 of teenage girls and nearly 1/3 of teenage boys use unhealthy weight control behaviors such as skipping meals, fasting, smoking cigarettes, vomiting, or even taking laxatives as a form of maintenance. 3 of the most common eating disorders are anorexia nervosa, known as severely restricting food, binge eating disorder, known for eating exceptionally large quantities of food without control, and bulimia nervosa, binge eating followed by behaviors to compensate for overeating, like vomiting or excessive exercise. Ultimately, eating disorders are very complex and affect all kinds of people. Risk factors for all eating disorders involve a range of biological, psychological, and sociocultural issues. These factors may interact differently in different people, so 2 people with the same eating disorder can have very diverse perspectives, experiences, and symptoms. Still, researchers have found broad similarities in understanding some of the major risks in developing eating disorders. Before we discuss the biological, psychological, and sociocultural causes for an eating disorder, I want to first review disordered eating as it follows this typical pattern known as the disordered eating cycle. The beginning of the cycle is binging, overeating, or doing bad. Some events can trigger a binge or an overeating episode, and this can be anything from stress to extreme hunger to the desire to numb oneself emotionally. This can then lead to feelings of shame, guilt, self-loathing, and then that post-binge emotions are running very high, and naturally, you don't want to experience those feelings of shame, guilt, and self-loathing again. So you find this determination to do better, to try and make sure you never feel those feelings again. So you decide that you will never binge again. So you will do good or restrict, diet, maybe purge, maybe over-exercise. This then leads to hunger and deprivation. As part of the determination to never binge again, you restrict more. This is both to balance out the large quantities of food you just had and to bring back a sense of control that you have lost during a binge. So inevitably, the cycle continues until the triggers for these actions can be identified. So if your child is caught in this cycle, remember to show them compassion. This is possibly more important than not restricting and removing the triggers altogether. Guilt, shame, and anxiety fuel the restriction. Restriction fuels the binge, and the cycle is incredibly unforgiving. But that's normal. It's normal to get into the binge restrict cycle, and it's normal to have difficulty getting out of it. That is why your support of your child is so important and so helpful towards their recovery. So an eating disorder develops when someone uses food as a way to cope. Eating disorders are a way of coping with not wanting to feel emotions or deal with certain situations. They allow the person to become numb or focus on something else, in much the same way that someone would misuse drugs or even alcohol. So eating disorders are complex and there's no one single cause. We're still learning more, and their development is most related to the perfect storm of genetics, mental, and environmental triggers. This means you need the genes for an eating disorder to develop, but it won't be expressed without an environmental trigger. Some people can have the genes for an eating disorder and go through their entire lives without seeing it expressed. So an eating disorder expert, Dr. Walter Kay, puts it, genetics load the gun and environment pulls the trigger. In other words, a person can have the genes to develop an eating disorder, but never express the thoughts or behaviors. Another person then could have the perfect storm of trauma and environmental triggers, but without the genes for an eating disorder, won't develop one. So biologically, having a close relative with an eating disorder or a mental disorder could be a cause of developing an eating disorder. Studies of families have shown that having a first-degree relative, like a parent or a sibling, with an eating disorder or issues like anxiety, depression, addiction, may increase a person's risk of developing an eating disorder. Additionally, a history of dieting. So a history of dieting and other weight control methods is associated with the development of a binge eating disorder. A negative energy balance. So burning off more calories than you can take in leads to a state of negative energy balance. Many people report that their disorder began with deliberative efforts of diet or restrict the amount and or type of food that they're eating in the form of dieting. So other causes can include growth spurts, illness, and intense athletic training. Some psychological causes of an eating disorder could be perfectionism. One of the strongest risk factors for an eating disorder is perfectionism, especially self-oriented perfectionism, which involves setting unrealistic, high expectations for yourself that are not easily obtainable. This relates with body image dissatisfaction. So body image encompasses how you feel about and in your body. It's sadly not uncommon to dislike your appearance, but people who develop eating disorders are more likely to report higher levels of body image dissatisfaction and an internalization of the appearance ideal. And then a personal history of an anxiety disorder. We talked about how families may have an increased impact on developing an eating disorder if they have a mental disorder themselves. However, research has shown that a significant number of people with eating disorders, including 2/3 of those with anorexia, showed signs of an anxiety disorder, including generalized anxiety, social phobia, and obsessive compulsive disorder before the onset of their eating disorder. And then behavioral inflexibility. So many people with anorexia report that as children, they always followed the rules and felt that there was only one right way to do things. And then lastly, social. So the truth is that there is a positive connotation around being thin and a powerfully negative connotation around being fat. The message that thinner is better can be found everywhere, from the magazine aisle to the media. It is very pertinent in our culture. So weight stigma is ultimately discrimination or stereotyping based on a person's weight and is damaging to our society. Teasing or bullying. So being teased or bullied, especially about your weight, is emerging as a risk factor in many eating disorders. Studies have shown that 60% of those affected by eating disorders said that bullying contributed to the development of their eating disorder. Weight shaming needs to be a significant part of anti-bullying discussions. And then buying into the message of the socially defined ideal body may increase the risk of an eating disorder by increasing the likelihood of dieting and food restriction by meeting society's standard of beauty. Limited social networks, so loneliness and isolation are some of the hallmarks of anorexia. Many with the disorder report having fewer friends and social activities and less social support. Whether this is an independent risk factor or linked to other potential causes such as social anxiety, it's still unknown. And acculturation, there we are. People with racial and ethnic minority groups may be at increased risk for developing an eating disorder due to complex interactions between stress, acculturation, and body image. Within 3 years after previously introducing the Western television to Fiji, women previously comfortable with their bodies and eating developed serious problems, where 74% felt fat, 69% admitted to dieting to lose weight, and 11% used self-inducing vomiting. So 29% ultimately were at risk for clinical eating disorders. So in response to the perfect storm of causes, these are common signs of people struggling with an eating disorder. Stating these common symptoms does not diagnose your child with an eating disorder. Only a healthcare professional can do that. However, I am sharing some of these signs to help you notice if your child may have the tendencies towards disordered eating. In general, behaviors and attitudes that indicate that weight loss, dieting, and control of food are becoming primary concerns and risks for eating disorders. So weight, that would be extreme concern with body size and shape, which often leads to dieting, so a fixation on diets where a type or a content of food like calories or grams of carbohydrates or grams of fat are being restricted. New practices of dieting and restriction, including cutting out entire food groups like no sugar, no carb, no dairy, veganism. Skipping meals or taking small portions of food at regular meal times are also a form of dieting. Additionally, activity, so over-exercising as a form of weight loss, or withdrawal from usual friends and activities as a form of isolation. Then body image, so frequently checking themselves in the mirror for perceived flaws in appearance, and then impaired perception of their size of body, which is known as body dysmorphia. There may be some bodily dysfunction, so stomach cramps or other non-specified gastrointestinal complaints such as constipation or acid reflux, menstrual irregularities, difficulties concentrating, dizziness or fainting, difficulty sleeping, or muscle weakness. And then ultimately appearance, so noticeable fluctuations in weight, both up and down, mental or dental problems such as enamel erosion, cavities and tooth sensitivity, cuts and calluses across the tops of their finger joints as a result of inducing vomiting, fine hair on their body known as lanugo, and then very poor wound healing. These are all possible common symptoms of an eating disorder. Your child may have one of these, more of these, a combination of these, but again, this does not diagnose your child with an eating disorder if they have not been medically expertly diagnosed. So next, I think it's important to bust 3 common myths about eating disorders. The first myth we're going to look at is that eating disorders aren't that serious. They're just a cry for attention. If you've heard this, I want you to know that that is absolutely false. The truth is that eating disorders have the highest mortality rate of any psychiatric illness. And due to the nature of an eating disorder, a person may go to great lengths to hide the behavior and may not recognize that there is anything wrong. People who struggle with eating disorders also have intense emotional distress and severely impacted by quality of life. So eating disorders are incredibly serious, and they are not just a cry for attention. The second myth is that only teenage girls have eating disorders. False. Eating disorders can affect anyone, regardless of their gender or sex. Although eating disorders are more common in females, researchers and clinicians are becoming more aware of a growing number of males and non-binary individuals who are seeking help for eating disorders. Additionally, eating disorders can develop or reemerge at any age. Although most people report the onset of their eating disorder in their teens and young adulthood, there is some evidence that people are being diagnosed at older ages. And then the third myth, an eating disorder is just a phase. They will grow out of it soon enough. Also false. The truth is that eating disorders are not a phase and they will not be resolved without treatment and support. Recovery time varies from person to person, and some people get better relatively quickly, while some take longer to improve. And although not everyone with an eating disorder will recover fully, many do improve with a form of treatment. Even with full recovery, many people with eating disorders find that they have to take daily steps to make sure that they stay well. So this can include planning meals, regular check-ins with a therapist, dietitian, or doctor, a form of medication, and other types of self-care. So next, we're going to discuss how to best support your child through your words and your actions. We'll begin by discussing some things you should avoid saying and doing around your child. First, do not comment on their weight. This includes commenting on or criticizing the size of their body, your body, or anyone else's body. When children hear us criticize body size, whether theirs or someone else's, we are teaching them that only certain bodies are acceptable. This message is reinforced by the media, which tells us that we should all aspire to be a particular type of body and that it is attainable if we just follow the right rules and follow the right diet. If your child's body does not fit that profile and you push to change that, you can set them up for a lifetime of battling their body. Size ultimately does not determine health, no matter what the media tries to convince us that it does. Just remember that comments on appearance that you mean to be complimentary can sometimes be interpreted negatively. For example, "You're looking well," may sound like a comment on their weight. Compliments on things other than appearance can help the person feel valued and is less likely to cause these worries. So for example, not saying "you're looking well," rather say "you have such a great personality today. You have such a great spirit. Your smile is shining." Those are beyond how their outward appearance looks. Next, avoid labeling food as good, bad, healthy, or unhealthy. So by refusing to keep certain foods in your home, such as higher calorie fat, sugar snacks, or drinks in the house deems these as unhealthy, or off limits, only making them sometimes more attractive to your child. So even if your children don't have access to these foods at home, they will eventually encounter them outside your home. And because their access has been limited, they may be tempted to overeat or binge on them, fearing these continued limited access. Learning moderation with these foods requires some regular availability and exposure. Similarly, avoid stocking your kitchen with diet foods or low-calorie alternatives. These foods teach children to be afraid of the non-diet or regular options. In addition, the low-fat or low-calorie alternatives are usually much less satisfying than their full-fat or non-diet counterparts. So pleasure and satisfaction are important parts of a healthy relationship with food. When food is pleasurable, we don't require as much of it to experience satisfaction. Less satisfying options can keep us eating in search of something that does satisfy. So in general, food just doesn't have a moral compass, and all foods fit in all situations. Next, do not pressure exercise or buy them fitness trackers, food trackers, or diet books. There are many apps on the App Store, maybe on your phone, that track calorie amount, and that is just not helping anybody. It is making it seem like food can control us. Instead, help your children find joy in being physically active, not for the sake of burning calories. Providing opportunities to be active as a family, such as biking as a family, going to a family swim session at a local pool, or tossing a ball or a snowball together in the yard. This will help your child find ways to be active because it's fun, rather than viewing exercise as an attempt to control the size of their body in response to the size of their meal. And then don't assume or speak for them. It's important to remember to ask your child who they may want to know about their eating disorder, and respect them if they don't want anyone to know about it. It's between you and them. Remember, gentle and collaborative. Be the team in this support system. So some things that you can support, and that we suggest that you do support, is that remember to listen without the need to fix. So asking how your child is feeling rather than asking questions about eating or weight changes, that's often more productive. It gives them the opportunity to talk about the feelings behind their eating disorder without making them feel that their eating habits are being carefully watched. Asking questions to better understand their emotions and their experiences are a way of validating their struggles. And ultimately, affirming qualities in your child that are connected to their appearance, such as are they a hard worker, a creative thinker, a compassionate friend, a gifted writer, help them understand that their identity is not defined by their eating disorder, and rather they have so much to offer the world, and then continue to support them until they're able to see that for themselves. Next, help them. Help them make appointments with their therapist or their dietitian, or help them figure out insurance. Helping your child also appreciate what their body can do, not what their body does look like. So our bodies help allow us to experience a hug from someone we love, the smell of our favorite meal, the feel of the wind on our face. They allow us to learn new skills and have fun with friends, and that these are the experiences that make life meaningful and fulfilling, not being a certain jean size or fitting in a certain shirt or looking a certain way in a mirror. Do understand that home can be tough. Home can be where many triggers originated with certain family members or memories. So be patient and move with them in this experience. Do give them freedom to make their own choices. So providing a variety of foods, not those that are good, bad, healthy, or unhealthy. Provide a variety of many foods, all of the foods, because all foods fit. Prepare meals and snacks with a balance of carbohydrates, protein, and fat, which will keep blood sugar stable, which also helps them feel full longer and get the nutrients that their body craves the most. And then I encourage you to reflect on your own beliefs. Being a model for your children is showing respect and regard for individuals of all sizes. So help children learn that the world is filled with diverse individuals relative to race, religion, political perspective, and body size, and reinforce the idea that people come in all different shapes and sizes and that it's okay to be a different shape and size from the person next to you. And then model a healthy relationship with food for yourself. This can be challenging as our relationship with food develops amidst confusing and often conflicting cultural messaging and experiences. A healthy food relationship can be uniquely defined for each person, but typically it may include avoiding rigid food rules, comfortably eating until full, flexibility in when and where you get to eat. There's no change in your mood or anxiety following eating episodes. Some attention is paid to healthy eating, but little focus on how much you weigh. So if you find yourself struggling in this area, I want to encourage you to also reach out to a healthcare professional who can aid you in developing in these skills, such as a therapist or a dietitian. And then mealtime can be very stressful for someone struggling with an eating disorder. So ask your child. Find out what is most helpful for them during mealtime. Have a conversation and ask about how they feel most supported. Talk to them gently and kindly and ask how you can best support them through family meals. Keep your conversation recovery focused. It can be challenging to be surrounded by negative talk regarding food, body image, physical activity, so many other things, that it may be something as simple as, will you have another cookie with me so I don't feel as guilty, or I feel so gross or full after eating all that food, or even, I'm really gonna have to work that one off. Comments of this nature can at times be very triggering and unhelpful for a child who may have an eating disorder or anyone else who may have an eating disorder. So strive to keep your conversation body positive and away from harmful talk. Be supportive. Keep a list of 3 to 5 meals on hand that you can offer as suggestions at mealtimes that can be helpful when they have difficulty making a decision of what they would like to eat. So this can be their go-to list for those circumstances. Keep in mind that each and every situation is different, and being flexible is going to be a very important thing. If you know someone's struggling at a meal, it may be helpful to simply ask them how you can best support them right then. In other occasions, it may be best to ask them about something positive in their life or a recent accomplishment or something that they are good at to keep their mind off of the food that is right in front of them. And then create a safe environment that helps them feel safe. For example, play music at your meals. This can be soothing, it can be a distraction, and it can aid in relaxing the mealtime. Just avoid forcing your child to clean their plate or tell them that they can't have seconds of a particular food or that they can't leave the dinner table until they finish their meal. When they're ready to eat, they will eat, and it's important for you to support them until they're ready for that. We're going to briefly go over the 9 truths of eating disorders. So many people with eating disorders look healthy, yet may be extremely ill. Families are not to blame and can be the patient's and provider's best allies in the form of treatment. An eating disorder diagnosis is a health crisis that disrupts personal and family functioning. Eating disorders are not choices, but serious biologically influenced illnesses. Eating disorders affect people of all genders, ages, ethnicities, races, body shapes, weights, sexual orientations, and socioeconomic statuses. Eating disorders carry an increased risk for both suicide and medical complications. Genes and the environment play important roles in the development of eating disorders. Genes alone do not predict who will develop eating disorders, and full recovery from an eating disorder is possible. Ultimately, early detection and intervention are important. These are the 9 truths of eating disorders. Ultimately, there's so many other things that you can say. But if you have any more questions, Libby Parker, the owner of Not Your Average Nutritionist, would love to help you. She wrote a book titled Permission to Eat, which is a practical guide to eating disorder recovery. She also hosts a podcast titled Permission to Eat that can be found wherever you like to listen to podcasts. She maintains all major social media platforms with the name Not Your Average Nutritionist. And then all these resources and more can be found on her website, www.notyouraverage-nutritionist.com. So thank you. Thank you for your time, and know that knowing the right thing to say to someone with an eating disorder can be very daunting. If you aren't sure what to say, just being there to listen makes a big difference. And remember to approach each situation with gentleness and collaboration. The truth is that up to 80% of those who seek treatment and have support will recover or go into remission. So just keep supporting your kids. And thank you so much for being there with me today. If you're curious about any of the resources that I found today, these are the websites that I looked at. For more information, go to the nationaleatingdisorder.org and ellensatterinstitute.org and notyouraverage-nutritionist.com. Thank you so much. Have a great day.